How to increase your chances of getting pregnant? I would like to answer this question. The first thing, the very important thing is start with the basics. To understand and to be able to answer this question, we have to go back to the basics, which are the menstrual cycle. We know that the menstrual cycle is got four phases. Four phases. The first phase is called the menstrual phase, which can take 1 to 5 days. Some people can take up to 7 days. The second phase is called a follicular phase. That's a phase from day 1 to day 13. Yes, you heard me very well. Yes, it's from day 1 to roughly day 13. Because if you look at the follicular phase, it's actually the phase in the ovaries, while the menstrual phase is the phase in the uterine cavity. Both of these phases are taking place almost simultaneously. It's very important because when we do IVF or any other method, we say you must come on your first day of your menstruation, usually to start the cycle. Now, the third phase is an ovulation phase. If you are a 28-day cycle person, you'll menstruate on day 14. Then the last phase is a luteal phase, which is day 15 to day 28. That's where implantation and many other things happen. But the commonest, the most important clinical issue there is the implantation. Now, let's look at the menstrual phase. During menstrual phase, the egg is not fertilized. Estrogen start dropping. In other words, estrogen start dropping, progesterone start dropping, and the sudden shading of the endometrium, which we call menstruation. From there comes the follicular phase. In this phase, the prominent hormone is a follicular stimulating hormone, which has been triggered by low estrogen and low progesterone in the menstrual phase. Then in this phase, the ovaries start producing the follicles. Yes, it's called a follicular phase. Right? And a dominant follicles automatically take over and suppressing the smaller follicle. The third phase is called an ovulation phase. There is a sudden rise in estrogen, however, that triggers the rise in LH, which then surge and that trigger ovulation. In this ovulation phase, the prominent hormone there is LH, luteinizing hormone. Slightly increase in the body temperature due to LH effect on the body. That can take about 2 to 3 days. A very slight 0.5 degrees Celsius increase in the temperature can happen. Now, when do the ovulation really happen? Because this is also the most important question. Or when does ovulation happen? If you are a 28-day cycle, you likely ovulate on 28. If you are a 30-day cycle person, you're likely going to ovulate on day 15. If you are a 32 years old, a 32-year cycle, you're likely going to ovulate roughly at 16. And a 17-day cycle, you're likely going to ovulate at day 16. What is roughly important as well is to remember that most of the time, post-ovulation time is usually 14 days. It never goes up or lower than that. That's one thing you should also remind yourself or remember. Now, luteal phase is mainly a progesterone phase. It's a final preparation for implantation. Progesterone is a hormone of pregnancy. is required for implantation to happen. Corpus luteum keep producing estrogen and boost progesterone, and then keep maintaining the inside of the womb for implantation to happen. And that implantation is mainly at a luteal phase. When can I have sex? When can I have sex? What is the right time to have that? Is my cycle regular? Is my cycle a 28-day cycle with ovulation on day 14? Not everybody have that, but roughly that's the time. Then according to the American College of Obstetricians and Gynecology, this means that your fertile window will likely be approximately 5 days before your expected ovulation to day 1 after that ovulation. The reason they say they say here, if you are a 28-day person with ovulation on day 14, therefore your window, which is actually the period where your pregnancy chances are very high, that's the period which is very important during the menstrual cycle, right? It's roughly from day 9, 10, 11, 12, 14. 5 days before your expected ovulation, according to your calendar, and probably a day after. Therefore, that's very important to understand this concept, because that's the what's going to answer your first two questions we started with. When can I have sex? When I want to be pregnant? Exactly what time? Fine. And what is my cycle? We should have answered that. Therefore, what is actually the time where I'm really at the peak of my fertility? Now it's 5 days before your expected time of ovulation and a day after. Therefore, that you can say it's 6 days. That give you much more chance to work on that period, on that time, because that's the time which you have got high chances of getting pregnant. Now, there are many techniques you can use to help you to get there. Few of those, they are ovulation kit which you usually buy. We call it ovulation predictor kit, which really rely on the level of LH, which happen to increase. Now, this ovulation kit, the problem is that the time they show you that you have ovulated or you are ovulating, they rely already on or giving you information of something already which have happened. Therefore, they are not really helpful in such a way to help you to get to pregnancy, except the definition of a window period for pregnancy, which I've given you. The second important test as well is what we call a BBT, which is really the morning after before you come to bed and check your temperature, and that it means you have to follow your temperature for the whole month. And look, a slight increase, and usually on day 12, 13, 14 there, which may be 0.5 degrees Celsius above the normal temperature. If you've got flu or taking any other medication, that can give you a false reading. Those medication which may interfere with your temperature. But the most common false result we get in patients who develop flu just around that time. Therefore, the temperature will rise, but not necessarily that it's because of they ovulated or something like that. The other important thing which you can use as well is called cervical mucus changes. Then cervical mucus changes is really changes which are caused by estrogen, which is produced by the ovaries or the follicles. This estrogen make changes in your cervical mucus, and to know that's the right time or is ready, It's usually when your mucus become egg white. That's actually the time you must know that that mucus is much more reliable, because it become egg white and very, stretchy, because it allows for the sperm to pass through. It's not thick and hard, and sort of preventing the sperm to go through the cervical canal into the uterine cavity and move up. And at that time as well, that mucus is said to be very nutritious for the sperm, and allow them to go through the crypts of the cervix and take their journey up to uterine cavity to the fallopian tube, so that they can meet an egg which has been ovulated. The reliable method which you can use for what we call follicular tracking, which we do medically and which we use for our stimulation and so forth, is an ultrasound. Which an ultrasound, I find it very, very helpful for tracking the ovulation. How we do it, we give you, let's say, medication or stimulation or induction, whatever. Then we, on day 1, 2, 3, or on day 5, or 3 to 5 days, and then we start tracking your follicular growth with an ultrasound, which is an endovaginal ultrasound. And then we can see your follicles started growing from 5 millimeters going to 10 millimeters, going to 15 millimeters. And we know that when you reach 16 to 20 millimeters, the chances of ovulation are very high. Then at that time, we can give you precisely the time you're going to ovulate, and precisely the time which you can see your partner, and then you can make sure that you have intimacy. Now, coming to position, as far as or during sexual intercourse, and so I don't know any position which will assist you to increase your chances of pregnancy. However, there's some lubricants which you have to be careful of. Some people will use KY gel, saliva, and olive oil, which are contraindicated. Some for pregnancy. The best lubricant you can use is Pre-Seat, the canola oil, and mineral oils. Those are fine. Now, also to increase your chances of pregnancy, remember, healthy body, healthy pregnancy. Therefore, your weight must be within the normal parameters. You have to be taking good nutrition and physically exercise as well, and reduce alcohol and probably stop smoking, and then also reduce the number of the caffeine intake. Now, according to the American College of Obstetrics and Gynecology, caffeine recommendation for somebody who's planning to be pregnant must be less than 200 milligram per day. And according to CDC, also recommend that using of pre-vitamin, and especially with combination with micro grams of folic acid, something like 400 is recommended. Really, there are important things: when to get help, when can I see a fertility specialist if I'm not getting pregnant. We say if you are less than 35 years, younger than 35 years, and trying to get pregnant more than a year, whereby you had unprotected sex for more than a year and nothing happened, then that's the time you actually have to come to see your fertility specialist. And if you are above 35, you give yourself 6 months, and if pregnancy doesn't happen, then you have to come much more earlier. The other thing, if you have any of these diagnoses, you don't have any waiting period. The sooner you feel that you need to see your guy, and you have tried some few months, nothing happened, you can urgently see your fertility specialist. Especially you have a diagnosis of endometriosis, you have given a diagnosis of polycystic ovarian syndrome, you have had a diagnosis of pelvic infection, and you have a diagnosis of, or you had multiple laparoscopies for ovarian cyst and so forth. Therefore, there is no waiting period, because already you have got a gynecological problem which actually can expose you or can make you to experience difficulty to fall pregnant. Thank you.